Hello, everyone. As Jessica put in the chat, we will get started in just a moment, letting people in. Welcome to the Community Foundation CEO Virtual Roundtable for September. We are happy to have you. We will begin shortly. In the meantime, please introduce yourself in the chat with your name, organization, and where you are calling in from. Okay, well, it is 3 o'clock. Again, thank you so much for joining today's CEO Roundtable. A few technical aspects before we get started. We would love for you to rename yourself to include your name, preferred pronouns, and organization. So please feel free to introduce yourself via the chat. And also rename yourself so that we have your name, preferred pronouns, and organization. To click live transcript and select show subtitle, you can view the full transcript. So we do have that option available if you would like to see the transcript. I see all those great introductions coming in. And then feel free, as we engage with each other in the Zoom, we want you to ask all the questions in the chat. So please do so. So we're going to have a great conversation. We will try our best to get to all those questions. And we're so grateful that you're here today. And with that, this is a great conversation that we're going to have. So I'm going to pass it on quickly to our wonderful moderator. We have Aubrey Abbott Patterson, who's moderating today. And so Aubrey, I'm going to pass it on to you.
Thanks, Jill. Hi, everyone. I'm Aubrey Abbott Patterson. I'm the president and CEO of the Hutchinson Community Foundation in Kansas. As a member of the CEONet Board of Directors, I'd like to welcome you all, but also thank the Council on Foundations for providing this service to community foundations and collaborating with our organization to plan such valuable CEO-level conversations for all of us. I think this is something we all look forward to and benefit from greatly. So thank you, Council on Foundations, for that. Today, we're going to be talking about ALICE. Have you heard of ALICE before? Yeah. ALICE is an acronym for Asset Limited, Income Constrained, Employed. And I think that what we need to remember is that ALICE represents a hardworking, tax-paying individual who gets up every day and goes to work like the rest of us. But they still, a person who's ALICE is not sure how they're going to make ends meet. As a population, ALICE is above the federal poverty level, yet still has a difficult time affording the basics of housing, food, health, childcare, and transportation, despite the fact that they're working every day. ALICE is vulnerable to just one emergency, one health incident, car accident, car repair, a harsh storm, anything like that. When an emergency occurs, ALICE may not be able to get to work, and that has a domino effect for every part of their lives, which means that people in ALICE can quickly spiral into poverty. When ALICE suffers, we all suffer, and local economies suffer. If ALICE can't afford the basics, that household cannot help stimulate the economy with their purchasing power. If ALICE falls into poverty, we know that puts a greater strain on local services. If ALICE cannot save for the future, we all bear that cost. As a framework, ALICE is an opportunity to remove the stigmas and stereotypes that we associate with other terms, such as the working poor or needy, and to see instead these individuals as our own family members, our neighbors, and our friends. Even though my community, like yours, has access to data from MIT and the Economic Policy Institute, I'm thankful that our friends at United Way saw a research-based model like ALICE because it provides standard local analysis to highlight the needs in our communities, our specific communities, and inform our public policy, our business practices, and community services, even down to the county level. These ALICE reports have been done in 30 states, maybe more than that, but I could tell it's been 30 states at least. And so that means not everyone has access to the reports, but those who do know that it's compiled and analyzed the existing sources of data and presents it in an integrated way, which offers a more complete and clear picture of our community's challenges and opportunities. Also, in addition to ALICE, in our conversation today, you'll hear the term benefits cliff or the cliff effect, which is the sudden and often unexpected decrease in public benefits that can occur when an individual receives even a small increase in their earnings. Sometimes when income increases, families lose some or all of their economic supports like SNAP, school nutrition programs, healthcare, childcare assistance, TANF, and housing that may result ultimately in a net loss of income. When lost benefits outpace a wage increase, many families will park or fall off of the cliff's edge, which ultimately stalls their progression in their jobs and careers. And for many, the cliff effect can create an anchor into poverty rather than a ladder out of it. So today, we will discuss how community foundations can play a pivotal role in leveraging resources, fostering partnerships, and implementing innovative solutions to address the needs highlighted by the ALICE reports. And with that, it's my pleasure to introduce our speakers. We have 3 of them today. Jennifer O'Flannery Anderson, President and CEO of the Community Foundation of Broward. Steven Shepelwich, Lead Community Development Advisor, the Oklahoma City branch of the Federal Reserve Bank of Kansas City, and Jackie Carrera, President and CEO of the Santa Barbara Foundation. I'm going to begin by asking our panelists a few questions. I'd also like to encourage you to feel free to chat and share your questions in the chat function. We'll be closely monitoring the chat to ensure that we have enough time to address your questions as they come up and along the way. So panelists, I can see 2 of you. I hope there's one more in there somewhere. There she is. And I think we'll begin now with my first question, which is just very basic. Can you help us understand ALICE in your places and the work you're doing to support?
Sure. Jennifer, did you want to go?
No, go ahead.
Well, first, I just want to say thanks for having me here. And I know we're all really grateful to be having this conversation. I think when I was thinking about this call, I was thinking, oh, I'm going to dedicate this to my mother, who is a single mother, raised 4 kids by herself, and was a master at balancing the income versus any of the benefits that she got. Most was compensation, but definitely the benefits and all the other things that came along with just trying to survive. And she was a master at balancing that, but not everyone finds it even remotely possible to navigate such a challenging situation. And it's just sad that an elementary school teacher who dedicated her life to teaching, had to do that for so many years. In California, where I'm from, we actually don't have the ALICE reports, but what we use is data from the Public Policy Institute of California, and probably more relevant to this conversation is the real cost data that is put out by the United Way also. And we take a look at the real cost data because the federal poverty data doesn't take into account really important factors like housing, the cost of childcare, food, healthcare, transportation, and just all of the many things that go into our budgets to make our life and our families, function. So we look at households, and about 42% of the households in Santa Barbara County are below the real cost measure. And so you talked about the poverty rate. This isn't about poverty. We just have so many people in our community because of the high cost of living and the disparity in wages that are actually struggling to stay anywhere close or above that real cost measure. And so in the extremely low category here, it's farm workers, it's cooks, it's personal aides, salespeople, childcare providers, people that we depend on every single day. And then if that's 42,000 and below per year in terms of income, and then you go to very low income, which is 70,000. Our area median income is about 100,000 per household. And that's 70,000 is our elementary school teachers, like my mother, or our administrative assistants or social workers. So it's a very large percentage of our population that we're dealing with in Santa Barbara County. I'll stop there and let my colleagues talk a little bit more about their areas.
Good afternoon, everybody. This is Jennifer. I'm from the Broward County Community Foundation, which is Fort Lauderdale, where I know many of you have spent a spring break or two. I think one of the things that was kind of shocking for me when I was trying to understand what ALICE looks like in Broward County is that it's over a third and almost up to a half of the population if you add in people who are living at the poverty level. So, and we've seen over the last few years when we looked at the 2020 data compared to 2022, really significant increases. So the survival budget that is part of the ALICE study, when they look at what does it cost to live to survive in Broward, it's over $81,000. But when we look at the median income for a family of 4, 2 adults, 2 kids, the median income is only $66,000. So we already have a gap between what it costs to survive, not thrive, and what our service community is getting. And when we look at the ALICE population in Broward, a lot of it are servers in restaurants, people working in the tourism industry, retail, we mentioned that already, cooks, waiters, waitresses, laborers, landscapers, the people that keep our lives running. So also, it can also be people working in our offices, administrative staff, as well, and teachers for sure. So I think it's one of my takeaways of understanding ALICE is that it's my friends, my neighbors, and people that I depend and rely on for all aspects of my professional and personal life. And really that what Aubrey said, that they're one crisis away from really coming undone. How do we help prevent that, and how do we help them get past surviving? So that's my takeaway on ALICE.
Jump in. I'm Steve Shufflewich. I'm with the Federal Reserve Bank of Kansas City, based in Oklahoma City, and it's interesting hearing the levels, the level of income mentioned both by Jackie and Jennifer, in Santa Barbara and in Broward. In Oklahoma, it's very different. And I think that's one of the strengths of ALICE, which really highlights one of the weaknesses of the federal poverty levels that we see, is that, for the federal poverty level, it is the same across the whole country. It doesn't change by county. And ALICE really takes us down to that county level and shows what is the cost of making it, just barely making it, becoming self-sufficient at the county level using county data, and also varying it by many different household composition types, one worker, 2 workers, different ages of children. All of those make a dramatic difference that's overlooked when we just look at the federal poverty limits and calculations. So I think that's a very important piece, and that's been very important for us in terms of advocacy and discussions with community stakeholders to say, what does this really look like in our community? Who are the people, not just are poor, but what even does poverty even look like here? How do we define it? Now we're using the Federal Reserve, we're using ALICE in terms of workforce development. And Aubrey mentioned the benefits cliffs. We have some tools that we'll talk about later today looking at public benefits and their interaction with income and with mobility. And ALICE does not look at public benefits, does not count that. we're trying to use ALICE as a threshold, as a goal, and showing how public benefits interact with income to get somebody above that level.
Stephen, this is Jennifer. I would just add to that. One thing I was reading is that the formula for determining the federal poverty rate hasn't changed since, I guess it was implemented in 1965. So that explains why, you know, they look at numbers across the country, and there's so many factors that aren't even considered. And so for me, it always becomes unclear if someone's at poverty level, 150% of poverty level, what all that means, because the underlying formula is so out of whack.
Right.
Very scientific.
Yeah, it hasn't changed. It was based on a basket of food at that time period. And, you know, though that's changed, our, you know, employment, family compositions has changed. And so it's radically different. There has been at the federal level pilots of an alternative federal poverty rates. Mm-hmm. And so that, I think that's something for everybody to look at and see how that's going to turn out.
You know, I think this whole idea that there are, you know, this is about the folks who are working, you know, when you hear poverty rate, you know, immediately it could for some conjure up an image of those that are completely dependent on federal or government benefits. And I know in Santa Barbara County, when you look at the real cost measure, 96% of the households that are below the real cost measure here, again, we don't have ALICE, so we use the real cost measure, have at least one person who's working in their in their family, in their household. And then the other thing I just would underscore is when we're talking about who this is, we also combine data that looks at, you mentioned workforce, we look at educational attainment and who has what degrees, high school, or no high school degree, any college at all. And then we also look at demographic information as well. And I know one of the factors is that we have 79% of our single mothers who are falling below our real cost measure in Santa Barbara County, which of course, single mothers, no surprise, childcare is one of the biggest costs when you factor in all those costs to the cost, survival rate, cost of living. That's a big one for all of us.
Jackie, I would add to that in Florida, it's probably similar in California, single mothers and then seniors. Mm-hmm. Seniors are a big part of the ALICE population for us and are really struggling with their income and fixed costs. So that's another area we're really trying to zero in on because of this information.
Mm-hmm. There's so much more to say on this topic, but I know, Aubrey, I know you have a series of questions.
Yeah, I'll keep us moving along. I do want to highlight that in your chat function, there's the COF staff has provided resources, and in particular, I want to highlight Stephen's work around the benefits cliff and what the Federal Reserve Bank has done is linked there for you. And Jackie, I also just want to highlight what you said about the fact that your state doesn't have the ALICE data, but you're using United Way data around real costs. And I think that's really important because there are probably other people on the call who don't yet have the ALICE data. I waited years for it, knowing it was out there and trying to piece other things together. Sounds like you've done it well, putting it together, but I do appreciate that, you know, that we have these reports now. So we're going to refer to it as ALICE, but know that there are various ways to get to really serving the people in your community who are this specific population. And the ALICE Day gives us a way to talk about people and destigmatize the way we've been talking about them in the past. So I want to turn to philanthropy's role and ask the three of you to really highlight for us how we balance the immediate support with long-term solutions for those who fall in the ALICE category. How are you doing that in your communities?
I can start if you want, colleagues. One thing that we've started to do with all of our grant making, especially the discretionary grant making we do, which is about 50–60% of all of our grant making, is we try to include a measure asking the organization to identify what segment of the population they are serving and to be able to track how many ALICE people their grant is touching. So right now it looks as though through our data about 90% of the grants that are under our discretion are going to serve the ALICE population in Broward. So we're bringing, I think, through that a greater awareness and asking the organizations to track that and holding ourselves accountable as well. I think a couple other ways that philanthropy could be really impactful with this topic is, one, to continue funding the ALICE studies and collection of data and interpretation of data. So perhaps we have to help fund other nonprofits to understand ALICE and to figure out how they can track it, not take for granted that they know how to do that. I think also we can help fund and pilot research and implementation programs that maybe then could be expanded and funded at the local, state, or national level. So could we pilot a program for childcare for working mothers that are in a certain segment of salary to help them continue to get childcare and be able to get promoted and maybe they might lose some of those benefits temporarily, but to really look at how do we fund some programs that then could be expanded. So I think, and the third way I think is also convening conversations about this at the local level to help our elected officials and other community leaders, especially the corporate market, understand this whole issue area and these people who are, like I said, our friends, our family, and our neighbors, and that we all need to understand it and figure out how we can help elevate the situation and provide more acceptable solutions.
I think most of the people in our county are really waking up to it because they may have been here a while, but they're realizing their kids can't live in this community anymore. So it's becoming very real, really fast. For us, we just taking a step back to 2018 or so, we were doing a strategic planning process. And one of the things that we committed to as a community foundation was two things. One, looking at the use of data and information, and we relied on that really heavily when we put together our strategic priorities in that strategic plan. And the other was the role of community foundations. And I think that's unique to this particular group that's here today. Our role has, in many cases, shifted from being a little bit more transactional in the grant making and maybe leaning in a little bit more to some systems change work. And so we did two things. We actually we narrowed our focus, which is always very painful. It's almost like a 4-letter word in community foundations because nobody wants to see their issue on the outside of this. But we did, and we prioritized basic needs like food, shelter, behavioral health, and healthcare based on that data we were seeing. And then we took issues. We actually named the working family as the focus of our strategic plan as we focused in certain areas. And so when we looked at the data around working family, the issues that rose to the top were childcare, the cost, so the affordability, but also the accessibility. How many slots were available? What's the workforce look like there? Ironically, those are the same people that are struggling the most with the real cost data for us. We looked at the workforce development, seeing that tier 3 jobs, which are the service industry jobs, and our whole economy, over 50% of our economy is based on service industry jobs. So we looked at those jobs and what the workforce, the trajectory looked like for folks. We were very concerned about the fact that so many of those service industry jobs didn't pay a living wage, didn't pay anywhere close to a survival level income, and also didn't come with benefits. And people were piecing together multiple jobs. And that industry is really unstable and unpredictable. So the majority of the households in our county were in this industry that was just inherently unstable and unpredictable. So we really focused in on the workforce. And then we looked at housing as well. So those 3 issues are what made up our agenda around the working family. And then at the same time as we had prioritized that, we set up an office within our organization, just with one person, but that was in learning and evaluation. So we were constantly taking in the data, taking in any new information about our county, but also what's going on in our state and across the country, and then looking at how and making adjustments to our strategy as we went. So that's one way that we approached it. The other is, as we were doing that, people got more and more interested in the United Way's report on the real cost measure, what we were doing around this issue. And now our elected officials have actually called for a poverty conference that's coming up next year to unpack what this means for us, our county. Believe it or not, in Santa Barbara County, you're going, oh, they're so well off. We are the second highest both child poverty rate in our county, in our state, and overall poverty rate in the state of California. That is absolutely pathetic. So that's why we have this focus on poverty.
But I think Jackie and Jennifer brought up some very important things. This idea of really focusing on convening and conversations, talking about this. What does it look like in your community? I think community foundations are so important in that and play such a particular and special role around that. And then this idea of system change, looking at how do we promote system change, because so much of this, when we really look at what's constraining people that are in ALICE category, people that are low income, so often it is not their own skills, but it's the systems in which they live and the option sets they have to choose among. And how do we shift those and change those? And that's really kind of at the forefront of our work with the benefits cliffs. You know, we're able to show now there's a very clear tool through the Atlanta Fed that is able to look at one individual in their household and show their benefits profiles and how that all their different benefits line up over time as they would increase their kind of career trajectory. And when we look at how those benefits interact, we see that you know, there is so many system issues. You know, each of those benefits, we look at them, TANF, EITC, you can name a bunch, housing vouchers. Each of them are designed in silos, and they just do not connect. And it has some very bad consequences for individuals caught in between them. And so this idea of system change, I think, is so important. But also, I think as we've been working on this pilot, one of the things we realize it's so difficult for a nonprofit, an organization working with lower income individuals that's overstretched, underfunded. The people that they're working with, the people that they're actually hiring are ALICE themselves. It's very difficult to change systems without financial support, and it's very difficult to get financial support for this kind of work. Rather, you know, and I love what Jackie said about switching, you know, shifting the idea from transactional to, you know, relationship and system work. That's so important, and so few organizations do that.
Stephen, I would add to that we've kind of experienced an extra bump in this with additional funds that came as COVID relief in 2020, 21, and then started to dissipate 2022, 23, 24 for sure. And so some of the organizations that provide additional support were able to provide more housing vouchers. And I know that our state invested a lot of money in childcare, and now it's getting pulled back. So, you know, again, our friends, our family, our neighbors are getting pushed and pulled, and they're just trying to get by and do what's right. And they get given more money to help and get through, and then it gets taken away. And their earning power isn't increasing at a level to compensate. So it's a really frustrating time, I think. And again, it's caused by a broken system that, like you talked about, is siloed.
You know, you mentioned COVID, and I just want to reflect for a second on COVID because, you know, I laid out our plan that had the vulnerable populations, right, that need the basic needs like food and shelter and access to healthcare. And then there was the working family, and we put them sort of in two different categories. And after COVID, or as COVID sort of started to overtake our community, we realized just how close to the edge so many of those working families and how vulnerable they are. And so we actually dropped the language around that because we are dealing with families in our communities that are all extremely vulnerable based on the fragility of the construct of their finances. So it's something that we really walked away from COVID with and realized for our own community.
I want to go back to this idea of workforce and ask you how the rest of us as community foundations you see could support job training, education, and other workforce development initiatives targeting ALICE individuals.
Go ahead, Jennifer.
Oh my gosh, my head is sort of all over on this one. I think one thing is we really need to have really good partnerships with organizations that are addressing workforce. The workforce organizations, ours is called Career Source. We also have another group called OIC, and our community college has a big career placement that goes through the certifications and the degree programs. And I would say traditionally, at least for my community foundation, we were kind of hands distance from those organizations. They weren't ones that we were on a first name basis with, that we understood how they worked, and that we even funded. So I think we as community foundations have to really understand. That's why understanding ALICE helped me really understand it's helping me understand this subject and where a community foundation can be impactful. So we have to start by understanding it and then knowing those organizations, having a relationship with them, and then funding some special projects. One of the things we funded with our local workforce organization is a summer youth employment program that now has 120,000 kids that get different summer jobs through this program. We don't fund all of those, but that's not something we traditionally would have done. And we've also funded some pilot programs for people coming out of prisons, re-entry programs, and some youth diversionary programs through the juvenile justice program as well. So again, I think thinking about us, how our dollars can be impactful, but first we have to step out of our comfort zone and really get to know and listen and learn from these organizations. And we're not authorities on that. So sometimes that's an uncomfortable place for us, at least speaking for me and my organization.
Yeah, I just ditto on all of that. Thank you, Jennifer. And I'm going to take it in-house for a minute and say that one of the things that we really committed to as a community foundation over the last 6 or 8 years has been to move towards, I won't say away, but towards the community. And by that, we mean showing up differently. And part of that means hiring people with lived experience in our community and understanding what that means. And I'll tell you, we have benefited greatly from the perspective of our staff, having lived through so many of the things that we're talking about on this call today. The other is that we are committed to fair and living wages for our staff. We do competitive survey analysis, and I know this doesn't seem exactly on point because we're all thinking about investing in others, but I think we have to look at starting with ourselves. And so really leading by example, prioritizing living wages for our own staff. And that's a lot in California because we have a 16% minimum wage, and now we have to have for salaries over $66,000 a year is your basic salary. And so it's quite a commitment, but it's something that we think is really important. The other is for our nonprofits. We've heard after surveying them for many years that trying to meet these things that I'm talking about, a living wage, and really paying attention to hiring, and with people with lived experience, which then also means investment in professional development, and maybe bringing somebody who doesn't come with a degree or something that you had required in the past. So you're talking about infrastructure, organizational development, professional development investments that a lot of community organizations, foundations, a lot of donors donors don't like to fund, right? They don't like to fund overhead. And so we made a commitment a couple of years ago to do two things. One, multi-year grant making for this reason. So there's something they can count on, but then also general operating. So to move away from more of that pigeonholed program, these are the widgets that we want to see counted. This is the outcome we want. We're more, investing now in the general operation of the nonprofits so that they can make those decisions about how to build that infrastructure in their organizations. That's an internal workforce issue for our nonprofits, but one that we prioritize pretty heavily, given that our nonprofit workforce is 15,000 strong in our community, and we know they're not making a whole lot of money. So that was one thing. And then the other is we have partnered, as Jennifer mentioned, with the workforce development boards. We are doing several studies with them, making sure that certain populations are included, like our nonprofit sector, like our childcare industries. We've also partnered with them and other economic development organizations on reports around the creative economy or the gig economy to try to get some insight into where are artists, where are those people who are working out of their homes and piecing contracts together, and just kind of providing some insight and some visibility into that sector. And then we also, when we identified workforce as a priority, we knew we had to look at education and just where people were. We had 80% of our, in our county, 80% of the population who are below the real cost measure at 80% without a high school degree. So we wanted to see what the barriers were there. So we focused on the A through G requirements that they needed to have to get into a college. So we invested in some planning, career planning and readiness with them in a program called Get Focused, Stay Focused when they're really young, and then stay with those kids all the way through high school. We invested in what's called Bulldog Bound program, which is in one of our communities. There's a great community college and kids weren't going. What was the barrier? And so we wanted to make sure that those kids got onto the campus, and the mascot is the Bulldog. So it's Bulldog Bound program to make sure that they had their eye on a possible, career or trajectory to go to the community college. Because we have such an incredible ag community in Santa Barbara County, we also looked at, it's a several billion-dollar industry here, which is, again, ironic that we have so many people who are food insecure. But we wanted to make sure that those who were living and their families were working in farms, they were living around farms, there's this huge industry that they could be a part of, that there was also a career tech movement that we were building out alongside the educational trajectory. So we invested a little bit in that. And then we also focused on some internships in many of the industries in our area. We have Vandenberg Space Force right around the corner, with so many a variety of industries that our kids and our students, our college students, community college students are often left out of. So we focused on the internships to get them inside those doors. And then finally, one thing that we thought was really, really important is all this infrastructure, all this investment in infrastructure around digital, broadband and the digital future in our county. They were filling in gaps, but we wanted to make sure that those people that did not have access, digital access, were getting the access not only to the hardware, but to the software, to the iPads and everything else, and the training that goes along with that, so that they could more fully participate in not only the workforce, but there's also educational benefits and there's healthcare benefits to that as well. So we really focus on digital equity now as a major priority.
Well, I would really like to extend an invitation to Jackie to just move to Oklahoma. That would be excellent. and
I'll talk to my husband.
I know it would be a hard sell, but I say that because that's such an excellent menu of opportunities you're doing there with local workforce boards and others around workforce development in Oklahoma. Just as an example, there's very limited engagement of private philanthropic dollars in the workforce development system, at least particularly the public workforce system. It's very rare, and And I say that to say that, you know, each workforce development board is different, each state's approach is different, and it can be very difficult to dig into that and see how to make an inroad or how to make a difference. In the chat, I put one resource, the National Fund for Workforce Solutions. I think they're an excellent resource for bringing in private philanthropy into the workforce development world and really showing some innovative, top-notch programs. It's a great place to look. And as I was thinking about this, there was another piece, I think, is that oftentimes when we talk about workforce development, we're talking about ALICE and all, we often think about income as what gets us out of poverty. It's the income that moves us up. Mm. But, you know, there's been years now, I'm sure y'all all, you know, 3 or 4 decades around the field of asset building, and that is so important. And it's still, in many areas, relatively unknown or not known well enough, not seen as the full picture. But this idea that, you know, a person can't spend their way out of poverty just through income, but need to really develop assets as well. And so I think that's a great way that foundations have played a role in that field, and it really marries well with this idea of ALICE. And I love ALICE in the name because it, you know, it puts it front and center, asset limited, income constrained. It does put a nod towards the need for assets.
Just real quick, I wanted to touch on, I sit in some of these community foundation meetings and I hear other people talk and I'm like, oh my God, I want to do that. And so I want to put something in perspective real quick about some of the things that I said, because we are fortunate at the foundation to have discretionary resources, and we've worked hard to build those resources. And not every community foundation has discretionary assets, and needs to depend on donor-directed funds to be able to support some of these things. So all of what I've talked about is possible, but our discretionary investments, sometimes, you know, with the workforce development reports, they could be like a $5,000 to a $25,000 investment. They're not huge, but our name on it, our involvement in it, that adds a credibility to the issue, and that attracts sometimes other funders as well. And sometimes we actually convene other funders to talk about what we're doing with a particular group just to attract other investment too. So I wanted to mention that as a way of fundraising for some of these things that go beyond what we're able to do as a community foundation. And then the asset building that you're talking about, Stephen, I just, it's so important, and we haven't gotten into this fully yet, but what we recently did was we set up an impact investment program at our organization as a vehicle, as a tool to start to make, to build our muscle around making investments. We've started primarily in bridge loans to nonprofits and like low interest loans, and then also to in the realm of housing affordability, because it just costs so much money. $25,000 grants are not going to go a long way in that area. But so we're looking at more concessionary loans and loan guarantees to support housing affordability. But as far as building wealth and assets, I just think if you can invest through, you know, concessionary loans to somebody who's starting a business, or to some of the business, like we have women's economic ventures in our county. They provide technical assistance to individuals who are trying to develop their own business. We have a group called the Children's Resource and Referral. They're helping mostly women and some men set up childcare businesses. So it's solving the childcare issue, and it's definitely getting them licensed and ready to provide the service for the community, but it's also setting them up in a business that's going to take care of their family for generations to come. And if you have the vehicle to be able to support those kinds of intermediaries, and at the grant is great, but if it's at an investment in their business in a form of a concessionary loan, that's something that community foundations could do as well.
Thank you, Steve, for pointing us back to the asset-based approaches, and that the beginning of ALICE is asset limited. I hadn't quite honed in on that. They begin with that. Income constrained is second. Also, Jackie, I continue to hear from you and Jennifer the roles that community foundations play, that we have discretionary grant making at our fingertips, many of us, some of us more than others, but also that we have a lot of influence over how others invest and how credible the topic is because of our involvement at times. Also, I love the addition of your work in impact investing as a way that we could also exercise our, our power in a community foundation. I want to move to measurement and how community foundations ensure their efforts are making a meaningful difference in the lives of those who are in the ALICE reports. What metrics or indicators do you use and can we use to measure success? Jennifer, in particular, I remember you talking about your Florida Chamber's zip code initiative, and I'm interested in that.
Sure. The Florida Chamber of Commerce started an initiative, and which really came out of the discussion about the benefits cliff for the ALICE population, that they saw that having a tremendous impact on the workforce of Florida, and what could they as a statewide organization do to champion this issue. So when they started to look at the ALICE population, who were they, where do they live, they got really detailed into zip codes. And so for our entire state, they've launched a website and database that tracks all of the metrics, third grade reading level, graduation rate, the median income, housing prices by zip code. So this has been a great tool for us to be able to, as we put grant proposals together, to identify perhaps what zip codes would be impacted by that grant, and then what would be some of the evaluation criteria we'll be looking at. We are in the process of applying for a Florida Children's Initiative to be part of the Florida Children's Initiative, which is the Harlem Children's Zone implemented in Florida. So right now we have 5 Harlem Children's Zones in Florida. We're applying to be the 6th one, and it's literally for one zip code in Pompano Beach, and it's around one elementary school. So this is going to be really interesting because we are convening a whole host of different businesses and nonprofits and government entities to adopt and commit to this neighborhood, and looking at health outcomes, education, and employment workforce, all based on the children in there and then wraparound services for those families. So this is going to be a really exciting opportunity for us to look at. Definitely, this is an ALICE population for sure, and being able to partner with the Florida Chamber of Commerce on their zip code and data, what we'll have to do to augment it, and then tying it right back to the ALICE report. So I'm excited that this is in the works and coming to life. And then it's also using a national model, the Harlem Children's Zone in a Florida way. So that's one way that we're doing it in pieces, and we're looking at really doing it holistically, but literally just one zip code. So maybe 5 or 10 years from now, we may be able to replicate this in 3 or 4 different neighborhoods in our county and be able to share that information. And again, we can fund the initial study, then it gives us enough information to bring in other private funders, and then to hopefully attract larger funders and government as well.
I love that. Thank you.
That's great, Jennifer. I can't wait to hear about that and maybe replicate your model. Measurement is so hard. Measuring impact is so hard. And when, we held our feet to the fire when we were doing our strategic planning process, because we're always asking everyone else about their impact. So we wanted to make sure we were getting ours right. And we looked at, we ultimately started to use, generally speaking, the results-based accountability approach. And so we recognize we are an intermediary. We are not directly responsible for, changing a system with a $25,000 grant. So we really looked hard at how do we measure our impact? So we are asking ourselves the question, what do we do? How well do we do it? The question is anybody better off? And that's where we realized we do not have enough baseline data in our county across all metrics to be able to answer that question, given the breadth of all the things that we fund. So we just embarked on developing a community dashboard. It had started with our public health department during COVID with a local organization here named Legacy Works. And so we brought Legacy Works in and said, can we go beyond the health data and combine the economic data of like the United Way's real cost measure and other local economic data, so many data sets out there, but how do you begin to start to put all these things together into a community wellness dashboard where we can all measure, use as a baseline, and then measure, see if there's any change in our interventions along the way. So that's what we're in the process of doing right now, looking first at housing and economics.
Steve, do you have anything to add here, or would you like me to move on to engaging broader community?
Yeah, we can move on.
Okay. And we have about 5 minutes left. And so it goes fast, doesn't it? I'd like to talk about how we as community foundations engage the broader community. What role do local businesses, government agencies, educational institutions play in addressing the issues highlighted in the ALICE reports, and how do we engage them effectively and collaborate with them going forward?
I'll just tell a quick story that our United Way did hold a forum, does every other year, where the real cost data is produced and has a panel and has elected officials. Last year, there was the Farm Worker Foundation executive director and 2 county supervisors, along with the representative from United Way, and they facilitated a conversation, and it was really well attended by a whole cross sector of our community. Businesses were there, philanthropy was there, nonprofits were there. And it was just really eye-opening for, I think, most of everyone, but a lot of the elected officials really took to heart some of the things that were being discussed about their constituencies. And some were already really knowledgeable about it, but most were just kind of coming up to speed on this. So it was really informative and educational. And out of that is, and I mentioned earlier, this upcoming poverty conference that we are going to be holding in 2025 with a human service organization that works countywide, that's being sponsored by our elected official who happened to be on the panel that day and is a champion for children and for the issue of poverty. So it's a lot's coming down the pike for us in that realm.
Stephen, did you want to add? Do you have anything on that?
Could you repeat the question real quick? I'm sorry.
Well, I was just looking for your input into the ways that we as community foundations can bring in businesses, government agencies, educational institutions, and how can we collaborate effectively?
Yeah, no, I think the employer piece is so important, and I think really recognizing that it's not just a income issue, and it's much more of a job quality, and being able to broaden that conversation beyond, because as soon as employers, you traditionally hear about, we need to raise our pay scales, and it's just seen as a cost. But there's a way of doing this, I think, that it can be a direct benefit to the bottom line of an employer. And there's all kinds of examples out there. There's some great work around it in this idea of job quality. And so even ways of improving the quality of a worker's job without increasing their pay necessarily, particularly when you look at the full package of public benefits that are available as well. So I think it's really entering into that conversation about job quality in the bigger picture, I think is really important.
I remember, well, we have an organization called Broward Workshop, and it's all of the business CEOs for the whole county. And you can imagine what the meetings are like. And they let they have traditionally allowed one nonprofit, only one, to be a member, and that's the Community Foundation. So when I took over 4 years ago, it was a whole big drama for me to become a member, and were they going to continue that? So anyway, we were in a meeting and talking about the ALICE population. And I said, well, you know, when I look at this data, the average hourly rate you need to be paying people is almost $39 to meet the survival rate. And they just couldn't believe that. They were never going to pay their people that much. That was ridiculous. So then I started to go over what the monthly costs were just to survive. So some of it is simply education. You know, when they're looking at their business, they're looking obviously at the bottom line and what it costs. They're not thinking about the people and what it costs them to survive. So I think with the position that we hold, the trust that we have built with the community and with philanthropists, we do have a unique position to be able to communicate this topic in an artful, meaningful, powerful way to the philanthropists of the community, to policymakers, and to the employers, because I really think the employers are where the rubber hits the road on this, where we're going to make the biggest change.
And, you know, I just want to put a plug in for data. I know this report, and it's been mentioned, is one of several, but, you know, when we're talking about this issue of quality jobs, one of the things we looked at is how many jobs are we exporting out of the community and what tier are they? And guess what? There's a huge number of jobs that are being exported, and they are the highest paying jobs. And then the ones that we're importing in are the service industry and the lowest paying jobs. And then you look at the number of cars that are moving in and out of our community, and that just not just impact on the environment, but the impact on quality of life for your family. Is that employee going to be able to go to their kid's soccer game or be able to pick up their child from childcare on time? So there's just all of these things are interrelated, and I think it's really important that we continue to look at all sources of data when we're making decisions programmatically about how we go about our work as community foundations.
One thing that really jumped out to me, and this will be my last comment, is when they broke the ALICE population out by age, those under 25, so the youth of our community, comprise 71%, at least in Florida, of poverty and ALICE. So 71% of all children, everyone under 25, is living ALICE or below. That's just staggering to me that the majority of our children are living in that situation. So that's a moral imperative to me. And then the second highest are seniors. Seniors are over 50%. So there's an economic reason, and there's also a humanitarian reason.
Mm-hmm. Steve, this is your chance.
Oh, no, I think
jump in and end it for us.
No, I think this is such an important conversation. I'm so glad that that the Council on Foundations is taking this on, and so many ways of attacking it, from the asset side, from the income side, local policy, state policy, and I can't think of a better group more well positioned to do it than the ones on this call. So thanks so much for being letting me be part of this.
Yeah, well, I want to thank all three of you for the stories you've shared, the resources, and also the inspiration to remember our Community Foundation superpowers, the influence we have in our communities with our partners, with the donors that we see in and out every day, the way that we can help them change the way they think and act. All around, we have a lot of opportunity to affect change in our communities and for the people that we serve. So thank you for reminding us of that and giving us some real opportunities to look into. I want to thank all of you for attending today. Thank the Council on Foundations again for this webinar. We look forward to seeing you again at our next conversation. And if you have topics that are important to you that you would like to discuss or hear others discuss, I hope that you'll reach out. Joe Gordon, myself, any of us who've been involved today, we'd be happy to help you make those connections. And in the meantime, we invite you to keep this conversation going on the Philanthropy Exchange. So thank you, everyone. And it's been a joy to be a part of this.
Thanks, everybody. Take care. Bye-bye.